Did you know that 70 to 80% of people with migraine report experiencing neck pain during or before their attacks? So hello, I'm Dr. Sam Kalakakis, and I'm a physical therapist that specializes in the non-pharmacological treatment of migraine and headache disorders. So today I want to dive into a little bit about the connection between migraine and neck pain and look at more of the science behind the relationship and why neck pain doesn't always mean there's a problem with your neck and what to do to help manage neck pain when you're having a migraine. So a little bit about the key reason why we have neck pain. So neck pain doesn't always mean that there's a dysfunction in the neck itself with migraine. So to understand this, we need to talk a little bit about something called the trigeminocervical nucleus, or the TCN. So this is a structure within the brainstem where nerves from the cervical spine, so this upper part here, and the trigeminal nerve, which is responsible for sensations that we have in the front of the face, converge. And this overlap creates a unique situation. Here, the pain signals from the neck can be misinterpreted as a headache pain and kind of come up and over the ear and into the eye. And for migraine, that pain can be referred or radiate from the actual center of the brainstem and go to the neck. And even though there's no underlying neck pathology or dysfunction, we interpret the migraine attack as neck pain. So this process is explained by the theory called convergence theory, where signals from the cervical and the trigeminal nervous systems are processed in the same area and they overlap, meaning they influence each other. So migraine can activates the trigeminal cervical nucleus, and it can cause neck pain. But conversely, a neck dysfunction or pain or tension in the muscles in the neck can overactivate the trigeminal cervical nucleus, or the TCN, and this gives a potential for triggering a migraine attack. So it's a two-way street. So how do we go about addressing migraine-related neck pain? So the good news is that whether neck pain is a trigger or a symptom of the migraine, that there are steps or things we can do to manage it. So here's how. One is by improving mobility. Stiffness in the neck or loss of range of motion can contribute to more tension and strain within the muscles of the neck, potentially activating or overstimulating the trigeminal cervical nucleus. So things like gentle range of motion exercises or stretches of the upper shoulders or improvements in range of motion can really help to restore movement and reduce discomfort. The second thing we can do is build strength and endurance. Weakness of the muscles of the neck and the upper shoulders can lead to weakness or fatigue from poor posture or strain of the upper cervical spine. So exercises like chin tucks or rows or pull downs or shoulder raises can help improve the muscular endurance and resiliency we have in the muscles related to the neck that can cause headache. The third thing we can do is reduce overactivation. So the tension in the neck muscles can amplify signals or make it more likely that we have migraine or increased migraine frequency. So techniques like deep breathing, mindfulness, progressive muscle relaxation can be strategies to help calm or reduce the stress of our nervous system or our muscles and reduce migraine frequency. And the other is more movement variety. So staying in one posture too long, like sitting at a desk, can cause your neck muscles to fatigue from holding in one position for too long and then overstimulate your trigeminal cervical nucleus to trigger an attack. So what we recommend then is changing postures more frequently and incorporating movement breaks throughout the day. So if neck pain and migraine are a frequent part of your life, physical therapy could provide a personalized approach for you. But as a physical therapist, we can assess your neck's mobility, your strength and endurance, and your overall neck function to create a plan that's tailored to your specific needs if there's dysfunction that we can assess. So this might include manual therapy, specific exercises for your neck and shoulders, and other strategies to help prevent attacks. So just to summarize, the relationship between migraine and neck pain is complex, and it goes both ways. From migraine causing neck pain and neck pain triggering migraine. So through the trigeminal cervical nucleus, migraine can cause neck pain without dysfunction, but neck pain or neck dysfunction can trigger migraine attacks by overstimulating the shared pathway. So by addressing mobility, strength and endurance, and reducing stress, we can help break this cycle of neck pain and migraine and improve your overall quality of life.